Christy Muller and her husband can't wait to be parents. But after multiple miscarriages, finding an obstetrician for her high-risk pregnancy hasn't been easy.
I was scared that I wouldn't be able to find a doctor who was going to cater to my needs, cater to my baby's needs, and also make sure that both of us was going to make it out of this alive.
There was already an OB-GYN shortage in rural Georgia before Roe v. Wade was struck down. But now doctors say the state's 6-week abortion ban is making things harder, in a place where more than half of the counties don't have a single OB-GYN. Dr. Joy Baker says the shortage of doctors is not just impacting patients who are pregnant.
If I called you today as a new patient for an annual visit, when could you see me?
September.
1 year since the overturning of Roe v. Wade, and the ripple effects are being felt across the United States. Dwindling number of OB-GYNs doesn't just affect pregnant people, of course, it also blocks access to routine care like mammograms and cervical cancer checks, as well as STD screening and other health-related checks. But for Republicans like State Senator Ed Seltzer, it's not a problem.
Are you concerned about a pool of upcoming doctors into your state?
If they're looking for providing abortions as part of their medical practice, Georgia can be a place they don't apply, and I think we welcome that.
State Senator Ed Setzler sponsored Georgia's abortion ban. While he acknowledges the women's health care challenges facing parts of his state, he says there are options.
When you think about the telemedicine that's available, you can have a doctor consultation. Those are pretty broadly available across the state.
But you couldn't have a scan to see if there were issues with the fetus.
The Life Act balances the difficult circumstances. And I think the idea that there's geographic barriers for certain women in certain communities misses the point that there's a living, beating heart and a child that's worthy of protection.
There's also a living and beating heart in the person who is pregnant, who needs these medical scans. And you're celebrating the fact that less doctors want to come to your state and practice medicine because of your draconian laws you're passing, because they're afraid they're going to go to jail for doing their jobs and giving best practice medicine to their patients. They're afraid they're going to be arrested or fined hundreds of thousands of dollars for saving lives, and you're celebrating it. You absolute ignoramus. It makes me so livid, and there's so much more in the story, Jessica, but I just want to bring you in now at the fact that he's celebrating people not willing to practice medicine in his state. I can't get over it.
If you're really pro-life, and you care about babies' lives and mothers' lives, and you want them to receive good health care when they are pregnant, what you're doing by making abortion illegal in some states is forcing women who are going to get an abortion anyway to go to another state and put more pressure on their OB-GYN market, on that industry. They're gonna have way less appointments. They're gonna probably be overbooked because of folks in neighboring states coming over to get the healthcare that they need. Now women who are pregnant are going to get worse healthcare because of the overburdened healthcare system in these surrounding states. I live in North Carolina. We have a lot of neighboring states that have passed more strict abortion laws, anti-abortion laws. They come here. That's a huge burden on the healthcare here. And I can see a world where the terrible argument is made by members in the US Congress saying we've got to pass a federal abortion ban because women are going from one state to another state. People who are pregnant are traveling across state borders to get an abortion anyway, not respecting state laws. We've already seen the insane draconian measures where if you actually live in a state where it's illegal and you travel to another state, they can prosecute you in your home state. That kind of thinking is just absurd. And so we're in a really terrible situation here where the same folks who have said states' rights, states' rights, states' rights are probably going to shift their position towards we need a federal abortion ban. And that's terrifying and scary because it's very obvious that even when you make it illegal, even when you make it clear that you think it's wrong, women are still going to get them anyway when they need them or when they want them. People who are pregnant, who are not willing to carry that child should have a choice as to what they do with their pregnancy. It's not up to some white guy named Mr. Seltzer. I'm sorry, it's just not. It has nothing to do with him.
Exactly. And he's preaching about how we need to be protecting babies' lives. But in reality, the laws he's passing are even making it difficult for people who want to give birth, who want to carry their pregnancy to term, to raise that child. For example, couples like the Mullers, and this is even more terrifying, that in a country in which the maternal death rate for Black women is 3 times that of their white counterparts, this is what they're having to go through.
A stark reality facing the Mullers, who now travel 40 minutes each way to see Dr. Baker as their due date approaches.
And hopefully my husband won't be stuck delivering on the side of the road.
A soon-to-be mother who wants this baby girl more than anything, worried their safety has gotten caught up in the fight over abortion rights.
Along with the fear of legal repercussions and the lack of resources, medical students are choosing to turn away from red states. Now, from CBS News, applicants in states with abortion bans plummeted more than 10% since Roe v. Wade was overturned, according to the Association of American Medical Colleges. We also have this from rollcall.com. The OB-GYN shortage comes at a critical moment. In 2021, the Centers for Disease Control and Prevention documented gains in cesarean delivery, preterm birth rates, and low birth weights, all of which can increase other health risks and require specialized care. Now, CBS News spoke with several current doctors who have chosen to leave their home states in favor of safer areas, and this is what they had to say. From CBS, Dr. Amelia Huntsberger was practicing in Idaho, where most abortions are banned. Now she's leaving for neighboring Oregon after her rural hospital closed its maternity unit, citing both staffing shortages and Idaho's political climate. It's very clear that Idaho is no longer a safe place to practice medicine, Huntsberger said. If I'm an OB-GYN resident coming out of residency and I'm looking around at different options, why would I look at Idaho and say, oh, I really want to move there to the state where I could be charged with a felony for providing medical care, she said. And I mean, Jessica, there it is. They closed their entire maternity ward, and somehow conservatives would tell you that that's good for life, that that's good for pregnant people. I mean, it's absurd.
It's absolutely absurd. I remember going to Kentucky when they had this ballot initiative, an amendment proposed to their state constitution that would, one, make it so that any public funding couldn't go towards abortions via Medicaid. And so that's a big thing to lump in with another amendment to the Constitution. And again, you're voting yes or no on this one thing, which includes both points. And the other was so that there was no guaranteed right to abortion in the state of Kentucky. And so a lot of people would read that and say, well, I don't want my dollars to fund abortion because I personally don't believe in it. And then they vote no on an amendment and then strip away a right that many of them actually believed women should have. When I spoke to folks in this state, just stopping them on the street, asking them how they would vote one way or another this past election cycle. And most people said, I think the biggest problem with pregnancy in the United States is that people feel like they don't have the resources that they would need to take care of a baby. And actually, most people don't actually want to have an abortion when they get pregnant. A lot of them feel like they have to because they can't financially provide for another life. And they say, I think that if you're in that situation, it's between, you and your doctor, or you and God. I don't like it. But most of them recognize from when I spoke to them that this was a really tough decision most people didn't want to make. And even the most conservative pro-life folks said that we as a country need to do better to provide for people who are pregnant, who are expecting a baby, and moreover, provide better jobs and opportunities for people who are facing this really difficult decision. And so the representatives we have in government are not representing their constituents. This is how the average American sees the issue. And so we have folks representing us that are not representative of the general populace. Even Kentucky voted that ballot amendment down. And so we have people across the state that are being represented by folks who have no interest in protecting women's lives, protecting babies' lives, protecting people who are pregnant, and protecting families, or just basic democracy, representing their constituents' views.
Exactly. And it's so strongly evidenced by the fact that if you look at the polling state by state, that these states that are passing some of the most regressive abortion bans, those bans are not popular among its citizens. I think there's not a single state where a majority of the citizens didn't support, at the very least, the limited restrictions under Roe v. Wade. So they really, really are not supporting their citizens. They're not representing them. So, that's when things like community organizing are so impactful and so important, so that you can actually fight back against these unrepresentative representatives.